nonprofit capacity building. We do governance, we do program evaluation, we provide, well, essentially we let we take people's ideas and we help them take flight. One of the things that we are working on, of many, is the Ballot Initiative 1. Now, if you don't mind, I'm going to just, I want to tell you, first of all, that in order to take on this ballot initiative and this cause, in order to take on any cause, I have to be behind it. I am a person in long-term recovery. I celebrate 33 years last February in recovery. Thank you. I am also a 30-year veteran of substance use recovery and treatment and prevention services. So I've worked professionally in the field for 32 years. I started as a young pup at a very, very entry-level position in a treatment center, and I just worked my way into 25 years of being a CEO in nonprofit organizations for substance use prevention, treatment, and recovery. What we have seen over time in the U.S. is that
you have to speak into it.
Is that we have tried to arrest our way out of our drug issues. We have abdicated our understanding of the disease of addiction to people who want to call it and continue to call it a moral or character issue, which it is not. We are forcing probation officers and parole officers to act as family therapists. We have given the Department of Corrections the responsibility for taking care of the people who have substance use disorder in our communities, and that needs to stop and that needs to change. The prison system in Ohio is at about 130% on any given day. So we're about 30% over capacity in our prison systems. One of the main objectives of Ballot Initiative 1 is to reduce the prison population. And it will do that in 3 ways. First of all, it will reduce the felony 4 and felony 5 charges of possession only to misdemeanor charges, which means that the felony 4 and felony 5 people who get arrested will now not have a felony on their record, and then they will not have that barrier to employment going forward and to becoming recovering, productive, and contributing members of our community going forward. It also means that instead of sending them to prison for treatment, where treatment is much less effective, they can stay at home in their community and go to treatment in their community. So the second thing it will do is create a system of graduated responses for people who are on probation and or parole to who violate on technicalities. So if someone violates by having missed a meeting with their probation officer, or perhaps they've missed AA meetings, or perhaps they have dropped out of their treatment process, those are technicalities that can send someone back to prison for a minimum of a year. So when someone gets violated for these technical violations and sent back to incarceration, they can't get sent back to incarceration for 30 days or 90 days like they can in municipal jail. So they could go back to municipal jail for 30, 60, 90, or a weekend for a wake-up call. But for prison, they have to go back, for a felony, they have to go back to prison for a minimum of 1 year. That completely disrupts their recovery services process. It takes them out of the home, and if they were working on employment, which they probably were, it removes their ability to continue to support their family. It takes away, and over again, this is part of the problem with the foster care system that we've been hearing about, which is that parents aren't available due to, not just due to their drug addiction, but due to incarceration because of their drug addiction, because of their disease, right? So With these graduated sanctions, we can do what we call in recovery terms, or in treatment of any other medical condition, which this is, we can change doses, right? We can change medications. We can change treatment strategies. We can actually adjust what we're doing with this person, change it up, and try to meet the needs of the person instead of punishing people for having a disease in such an extreme manner as sending them back to prison. So the graduated sanctions, how many, does anybody in here know how many probation offices we have in Ohio, in our 88 counties? We've got 188, actually, 188 probation offices. And we're very independent people, right? So we do 188 different things. And this will help create some consistency, which helps create justice for all in a way that we aren't doing right now. So the third thing is it will allow for what they used to call good time, but earned time credit for people who are in prison to work towards something that will allow them to get released earlier. Now we have this already in Ohio, and what we have now is an 8% reduction in time for the amount of total for the amount of time that you have that you are sentenced to, and you can do programming up to reducing your sentence for about 8%. But the proposal is to bring it up to 25%, which seems, all of a sudden like a jolt, right? But in fact, 25% is the national average among states that provide good time or provide earned time credits. That's not the most you can get. It's definitely just the average across the scheme. So that means that they can earn up to a half a day per day of programming. That doesn't mean that the warden has to release them. It doesn't mean that the judge has to agree. So in fact, the person still has to have actually done some work in those groups. They have to actually have had a good attitude. They have to actually not be dangerous to put back out on the street as determined by the corrections folks and or the judge. So it's not a matter of releasing a whole bunch of criminals, violent and dangerous criminals, back onto our streets. In fact, those folks will be coming home anyway. And wouldn't it be better if our rehabilitation services actually provided some rehabilitation to them before they were released back into our community? So those are the three main mechanisms by which we will reduce the population by approximately 10,000 people. Now that will save a very low and conservative estimate of $100 million annually. That $100 million will be cut up into three pieces. 70% of that $100 million will be redirected to the Department of Mental Health and Substance Abuse Services, and they will then facilitate a grant process to communities across the state. And that grant process will be directed to treatment providers who are providing treatment services and supported services to people with substance use disorders in the community. And each community will be able to say, this is the issue that we have specifically in our community. It may be opioids. I hear right now that Dayton is beginning to be inundated with methamphetamine again. So it doesn't have to be opioids. I have had that question before. It's about substance use disorder, which is the diagnosis. So, and prevention services will also be included in that. So you can provide family services, which are prevention services, right? You can provide employment services, which are prevention services. Relapse prevention services, which are prevention services. You can provide a whole host. It is a fairly, it prescribes that it will be a grant program, and it prescribes that they be evidence-based services, but it does not say specifically it has to be this evidence-based service. So there will be evaluation that needs to happen, and that's actually written in. The other thing that is very important about this is that the language in the amendment, we've learned from other states who have adopted this, and we've learned from other constitutional amendments that we've passed in Ohio, that we have to be careful with certain language. One of the pieces is that these funds that will go to provide mental health, behavioral health services cannot supplant current monies. It has to supplement. This will be in addition to anything that's currently being allocated for behavioral health services in the state. We have Medicaid expansion, which has and does help so many people in the state, and thank goodness for it. These dollars will help supplement those Medicaid dollars and will provide for infrastructure. They will provide for things that you can't bill Medicaid for. Recovery support services. We know that these are very effective services for people, for peer support in recovery supports. So those are the kinds of things that employment, housing, et cetera, that we'll be able to use the dollars for. I'm sure that I have neglected to say some things, but I expect that you'll ask good questions that will help remind me what I forgot to tell you.
Thank you, Molly.
You're welcome. And should I take questions, or do you want me to
Do
wait?
you want to wait till
Yeah, let's wait.
till we hear of Heather?
Yeah.
I'd rather wait.